Dr. Pranita Sahay. Dr. Pranita completed her MD from the All India Institute of Medical Sciences. She subsequently did a senior residency in cornea and refractive surgery also at AIIMS itself. She is highly qualified, having done the FICO, the FAICO, the FRCS, and the FRC OFT examinations, and currently she works as a consultant at CFS in New Delhi.
Thank you, sir. Thank you, sir, for the introduction. So, as you all know, there are multiple exams that you have an opportunity to give along with your post-graduation. You have the FICO, FAICO, FRCS, FRC. So, which one to choose, how to prepare, and when to give the exam is the question that we need to ascertain and establish so that we are well in time, well prepared, and complete all the exams without failures. So when you're doing your post-graduation, you need to be clear about what is your future plan. Whether you want to go abroad, settle abroad, or you just want an international fellowship training from outside India. So based on that, then you choose the exams. As we discussed, you have the exams like ICO, FRCS Glasgow, Edinburgh, Ireland, and also the FRC OFT. So I'll be dealing about the ICO exams. Now, the ICO exam is quite a structured exam with multiple steps. You have Part A dealing with basic sciences, Part B dealing with optics, refraction, and instrument, Part C, the clinical ophthalmology, and then the advanced exam. Also, the ICO in the past few years have come out with the subspecialty exams. Now, there are certain advantages of giving these exams. One, that you get a post-acronomial of the FICO that adds to your qualification and CV. Second, it gives you exemption from other exams, that is the FRCS Glasgow. So, how to go about preparing these exams and when to give this exam is the first question. So, first of all, I would like to ask you, how many of you are postgraduate students or fellows who are sitting out here? Can you raise your hands? So we have quite a few. And have you appeared for the ICO exams as of now? Anyone? No. So I think you're looking forward to preparing for it. So what do you think is the right time to start appearing for these exams? Anybody answer? Do you start in the first year, second year, third year? What do you think is the right time? Anybody? So I think with the end of this talk, things will be pretty more clear. So for the FICO Part A, you will need to understand that other than the anatomy and physiology of eye that you deal with in these questions, there are also some questions related to basic sciences, wherein questions of neuroanatomy, genetics, biochemistry, pathology, and microbiology are asked. Hence, that the best time to appear for this exam is in your first year of post-graduation, because that is when you're fresh with this MBBS knowledge. Now, this exam is an MCQ-based exam. The best part of ICO is there is no negative marking. So always go and attempt all questions in your exams. What to read? As for anatomy and physiology, you read Khurana, American Academy of Ophthalmology. Another very important book is by John Ferris, which is on the basic sciences and ophthalmology, a self-assessment guidebook, that it is in a question-answer format with detailed explanation of every question. So that book is really helpful when you're preparing for FICO Part A. Part B deals with optics refraction. Again, an MCQ-based exam, no negative marking. Books on Elkington, Chua's optics book, Duke Elders, and the book by Khurana. These are some of the important resources for this exam. The third part is that of clinical ophthalmology. This is just like your postgraduate MD or MS final year exams, wherein you need to have a detailed knowledge of the theory related to ophthalmology. So you need to read Kansky really well and American Academy of Ophthalmology. Again, this is an MCQ-based exam, no negative marking. It also gives special emphasis on general medicine-related questions in ophthalmology and community ophthalmology as well. The final step, which is the advanced examination, gives you the final degree of FICO. Now, the question preparation format is not very different from clinical ophthalmology, but here the questions are more focused on case-based scenarios or clinical scenarios. Hence, once you're done with your MD exam and your practical exam, that is the best time to appear for it, because you have an in-depth knowledge of this subject at that point of time. Also, there are questions related to ethics and community eye, which you need to read in addition to just your practical ophthalmology. So again, you need to read Kansky and American Academy of Ophthalmology. Remains the same as that of Part 2. When to appear, we have already discussed. Part A, start in the first year of your residency. Part B, optics refraction, only after 6 months or 1 year. That is when you get a basic hold of your refraction. Part C, after your MD exams. Advanced examination after you're done with your practical. Coming to subspecialty exam, you're eligible for it only after 1 year of fellowship in that particular specialty that you've been trained in. Now, don't start giving exams just randomly. Be well prepared because it comes at a cost. And yes, if you appear for all 3 steps of just ICO, it costs about 1.5 lakhs. So be prepared for the exam, only then appear for it. And be sure that what is your agenda of giving the exam. If you're looking at an international fellowship with grants, then this is a good platform. FICO will give you the post-acronomial of FICO, opportunity for fellowship with good scholarship and grants. Moving on to the subspecialty exams, as I told you, you are eligible for it only after you're done 1 year of your fellowship. So there are 2 platforms. One is FICO, the other is FAICO. The FAICO is given by AIOS itself. Both of them gives subspecialty exam options. Now, why is it important to give a subspecialty exam? For example, if you're going to go into private practice, often even if you've done your senior residency in cornea, someday your patient is going to come and ask you, are you trained in cornea? And then you actually need to convince them that yes, you have a qualification which declares you that yes, you are trained in cornea. So if you want to do a subspecialty practice, I think it is really important that you clear these exams well in advance so that, when you are facing these questions, you don't hesitate in answering. So the subspecialty exams come in cornea, glaucoma, retina, oculoplasty, neuro-ophthalmology, strabismus, uveitis, and cataract. Again, it's an MCQ-based exam, no negative marking. The advantage of FICO subspecialty is there are no practical exams involved. It's easier to clear. If you go on to FAICO subspecialty exam, you also have the option for giving refractive surgery and comprehensive ophthalmology exams and getting degrees for that. The disadvantage here is you have a practical exam. After you clear your theory, you have to face a viva just like you face in your postgraduate examinations. So only if you are well prepared, then appear for it, because the failure rate in practical exam is quite high in FAICO. So in the end, I would just like to conclude that you can look at the ICO exams if you want to go ahead for an international fellowship. If you want to go into a specialty practice, go for a subspecialty exam like FICO and FAICO. Plan well in advance and appear at the ideal time, because appearing earlier or later, both is going to put you in a disadvantageous position. Thank you.
Thanks, Dr. Pranita. I think you made my talk coming up a little later very much easier and shorter. We will take a question from the audience now. If rather than focusing the discussion, is anybody appearing for these examinations, the ICO, right now? And if they have any questions, we'd love to, or their experience of the examination, we would love to hear from you. Okay, then what we will do is we'll probably take questions and discussion after the next 2 talks. Please go ahead. Yes.
Unfortunately, there is no structured place where you can find questions for them, because as you know, these are booklets that are collected at the end of the exam. It's only by recall basis your seniors can let you know what happened in the last exam, but there's no structured place where you'll find questions for it. The FRCS question, yes, in John Ferry's there are recall questions that are placed in there, but unfortunately, I'm not really aware of something that helps in ICO.
Okay, thank you.